There are a few types of acne scarring. One of the most common one is the ice pick scar, and then there are the box scar and the rolling scars, as well as the atrophic scars and the hypertrophic scars. An ice pick is a very narrow instrument and very sharp instrument. So they have used this term to describe the scar because this scar itself appears as if an ice pick has been used to puncture into the skin. So what you see on the skin is a very narrow and very deep hole. Rolling scar is a scar that is quite broad and has very smooth edges in comparison to the other similar type of scar, which is a box car scar. A box car scar is a scar which is almost the same dimension and deep as well, but the edges are more angulated. An atrophic acne scar is a scar that has been there for many years, and it may originally be a rolling scar, and then as time passes, the scarring process itself dims down and becomes more and more atrophic. Atrophic means that it's not so active anymore. So these atrophic scars, what we can do is that we can actually press it, pull it outwards together, and it can actually flatten out. These are the atrophic scars. Hypertrophic scar is a scar that is bigger than usual. Hyper means more and trophic means growing more than usual. So hypertrophic scar is a scar that is not flat or depressed but actually becomes lumpy, and this is caused by the excessive collagen. The fundamental reason of scarring in the skin is when there's damage to the skin. A lot of times we tell patients not to pick their scars, not to pick the acne or the pimples, because we don't want it to get infected. Whenever we use our fingers to pick on our pimples, it can transfer infection, bacteria, and cause more infection on the skin. This can cause more scarring. What happens in Asians and Orientals is that we have a lot of post-inflammatory hyperpigmentation. When there's inflammation in the skin, what happens is that there are a lot of mediators and a lot of blood vessels come in, and this can cause redness in the scar. And the inflammatory mediators can also stimulate the melanocytes in the skin that actually bring out more pigmentation within the scar. For acne scarring, first we want to prevent new lesions. So definitely we will use topical treatment and oral treatment to help to control it, any more lesions from forming. And this topical treatment can also be used to rejuvenate the skin. More invasive methods, we can also try to use acid to smoothen the skin for very small areas such as ice pick scars. We can also use CO2 lasers to use a form of leveling of the skin to make it smoother. And for more difficult scars, we can use surgical methods such as dermal grafting as well as fat grafting and subcision. Lasers can be used to remove the top layer of the skin in a very controlled fashion. Because the laser, you can actually decide how many microns of skin you want to remove. Laser technology now is also good because it can be fractionated, meaning that you don't have to remove the whole layer of the skin at one time. You can remove very small microthermal zones of the skin, so that reduces complications and helps the patient to recover faster with the newer lasers. Lasers can be used to treat discolored scars as well, because these discolored scars, they are caused by pigmentation, and some of them they're caused by vascularity. So we can use lasers to reduce vascularity as well as to break up this pigmentation within the scars, and eventually the scar will become lighter in color. For treatment of scars, we have to control the acne first, and then once the flare-ups have been stabilized, then we can treat the scars. We don't want to treat the scars while the acne is active, because any treatment for scars can actually exacerbate the acne and make it worse. When a person has difficulty with controlling the acne with over-the-counter products, then it's time to actually seek a specialist to treat it, because any form of scarring, once the skin is scarred, it's very hard to change it or to make it look like normal skin. And once you have a scarring on the face, you can have it treated as soon as you want, as soon as possible, once the acne is under control.